Hey folks, Ashley here, allthingsdentistry.com, wearing my protective lenses. And what I want to talk about today was, let's come on over here, is just curing lights. I had a request for, why not get some more basic information out there? So here's the basic information. I think it's a great idea. So we'll talk about curing lights. The most common two different types are QTH, which is quartz, tungsten, halogen, and LED. The argon, plasma, laser ones are fairly expensive. The literature doesn't really show a benefit. And again, they're fairly expensive. So the QTH was a classic. What I've done is I've dismantled one of these, don't tell anyone, to show the inner workings. So we've got essentially a fairly bright white light bulb, and you hit the go button and it just lights up. How it turns blue is through a filter. So all the light that's not used by the composite to cure is all filtered out. And then it comes through, so put it together, comes through this little fiber optic doodad, and then boom, onto your composite. It emits blue light because I don't know if there's a composite out there that doesn't cure with blue light. And there's a specific wavelength, which is around 468 nanometers. That all these curing lights use, and there's a chemical, and I can get into that later down the road. So an LED light, nice and light. There's a version here. I tried to make this work. I can't. I like to throw things in the garbage so they don't work because they just seem to never get fixed. Another story. So here's another one. This one's plugged in. It's nice and light. It's great. The problem with LEDs, even though they're really functional, is that they're a very focused wavelength. So if you have a chemical that is out for curing, if you have a chemical that's out of that wavelength, it won't cure it. I think that's becoming more and more taken care of by different chemicals that companies are using, which is something to note. And so this is going to emit blue light. Again, there you go. One of the things with this is that the LEDs get smoking hot. Well, I guess if I left it on longer. There we go, that's like superpower. 4 bars. So they get really hot, and depending on the length of cure, you can start burning things. This one, I've got my finger on it. This one seems to be okay. Okay, well, we'll be there all day. Okay, maybe it's not that hot. This brand isn't that hot. So the last thing that I want to talk about just quickly, we're at 3 minutes, is that when you're curing, before you go to cure, make sure that the guide table is clean. You can see here is a bunch of composite on it from before, and that affects the power and the power density that comes out of this. So hope that helps. A little bit about curing lights. Cheers.